Next, I'm going to introduce Dave Byrnes. Dave Byrnes will bring up his panel as well, but this is really exciting for me because these are my local peeps that are going to be presenting here, so it's really cool. Most of you probably know Dave Byrnes. He's been with our region for a long time. He's our medical reserve coordinator, and if you don't know what that is, I really encourage you to have a conversation with Dave about that, either today or in the near future, and learn more about that and your opportunities to participate.
Thanks, Ed. I'm going to leave some cards up here. I don't want to take up a lot of time here because we've got some folks that want to tell you about what we did down in Odessa. And when I say we, I'm actually talking about 6 volunteer Medical Reserve Corps folks who agreed to go down to the Center for Domestic Preparedness first part of this year, first week in January, for a training course on how to properly decon. And a lot of folks have equipment that some of them haven't seen. We experienced a little bit of that down in Odessa. And so what we've got here is a group of folks who will come to you as volunteers and help you with that process. And where did Laura go? She left. That's right. I told her I might introduce her. One of our instructors is Laura Barrett from Pullman, and so I was going to introduce her so that she'd have a chance to tell you a little bit about what an instructor does. But what I really want to do is turn this over to Abby and Megan to give a little short video or PowerPoint presentation on what we did, what they did, and is that what you wanted to do? And while they're coming up, if you'd like to have a copy of this presentation that Megan put together, or maybe Abby, I don't know which, we'll get it out to you so you can take a look at what we did. And this was a real experience for me because I actually took some pictures. There you go. This is Megan and this is Abby. Here's the microphone.
So, I'll wait till he gets ready.
Okay.
So Abby and I in our hospital are both involved with the disaster planning of our hospital. And one of the areas in our hospital that we know we're really, we don't have a lot of experience in is the disaster training. Being involved with the Region 9 Healthcare Coalition, I was hooked up with Dave Byrnes, and he put together a group, and I helped interview the group that was going to go down to Anniston to do some training. So they can come back up to this area and offer trainings to all of our local critical access hospitals that might need help in this area. So we were actually their very first hospital since they came back from the training to train us. So we were kind of their guinea pigs. But it was a really good day. Abby developed a core group in our hospital that got together and did the training, or did some kind of work before they came down, learning how to put on the suits and kind of going over just some basic disaster stuff. But when the group from the Medical Reserve Corps of Eastern Washington came down, they did a lot more education for us in the classroom, and then they also helped us set up the tents outside. So we'll go ahead and go through the slides, and I'll let Abby, oh, this is kind of about our facility. We're a 25-bed critical access hospital. That's really kind of a misconception on our facility because most of our patients, they're long-term care. We maybe get 1 patient a day in the ER at the most, maybe have 1 to 2 acute patients a month in our facility. So if a disaster were to occur, it'd be kind of scary, especially on nights and weekends, because in our whole facility, we only have 2 licensed nurses and 2 nursing assistants in the building at any given time. We don't have any ancillary services 24 hours, no housekeeping, no maintenance, no security. I mean, that's all we got. We got 2 nurses and 2 NACs. So the other problem is our staff has had very limited disaster training. We have all the equipment, but the training is really lacking in our facility. And I think a lot of that is due to our administration. We've had a lot of changeover in administration within the nursing department, hospital administration, maintenance, the people who used to do it before never trained our staff to do it. So we were definitely worried about if a disaster were to happen, how would we function?
So we had them come down. Dave, like Megan said, set it up.
fantastic deal. You know, when I took over the position, there was things that were like outdated, like they said earlier, that were dusty. A lot of our stuff were not up to the standards anymore. We had the old suits, we had the old filters. Nothing had really been gone through. So it was really a good experience to have, you know, Dave and his group come down. They showed us so much, really, they did. Let's see. They did a lot of the personal protective equipment. They sat us down, you know, and they went over everything. Thank God that I had already gone through and brought the updated stuff, because Dave would have gave us a bad time, I'm sure. But it was a good experience. They showed us how to do triage, how to set it up, the hospital decontamination procedures. We had just set up this core group, like Megan was saying. We didn't even have that. We were doing training throughout the whole staff last year, and we found that to be not a very good deal, because nobody really wanted to do it. So we ended up getting 9 volunteer people to do this. And the reason we did that was we needed to have someone that could come in case we had a disaster. I mean, when the medical, everybody that Dave brought down, I was pretty impressed, because they came to me and told me what I had in my town. Okay, they had already observed that the train goes through there. They'd already observed that we had, you know, the gas station with fuel that they keep there with the big tanks. We had a biodiesel plant that comes and goes. It depends on how things are going with that. They had already established that we had our sub station where all of our electricity comes, and all of this is all in one corner of our town, same side. So I was pretty impressed that when they showed up there, they'd already knew what kind of dangers we had. Let's see. The training and the education to support your facility needs. What were the needs of OMHC? The knowledge and instruction for our core disaster group regarding our hazard assessment. Also understanding of the types of threats that are most likely to hit Lincoln County and Odessa. We talked about Wilbur, which is just 36 miles north. They have, you know, fertilizer plant. Harrington, which is 23 miles east of Odessa, had a ammonia or aqua spill, and there was some danger there. Our little towns don't do the, you know, get-togethers and things like we should. So again, you know, I thank Dave and his group for coming down. The personal protective equipment, as far as the training and education, and then the setting up of the decontamination equipment. When we took our stuff down, our trailers, and even the core group didn't even know where we had our trailers at that point. We had talked about doing a setup of our own, but then when Megan and Dave talked, we thought that would be a better idea versus us trying to teach, you know, have someone else that they don't know come in.
So I definitely want to point out that Dave's group, they made sure that what they were going to teach us fit our facility needs, and that was wonderful, because we had a meeting up here and it was going to be all education pretty much in the class. I'm like, whoa, wait a minute. Our facility, this is what we need. We need a little bit of education about the hazard assessment of our facility, but if something were going to hit us right now, and the core group of people that are going to be out there, they need to know where the trailers are, how to set up the pull everything out of the trailers, how to set it up, how to put on personal protective equipment. So I definitely want to thank Dave Byrnes' group for definitely fitting their education to the needs of our facility and what our core group needed. So
the other things, that like they mentioned to us, well, that's just little things that I'm going to tell you what to do. They're actually, to us, were a big thing. When we pulled our equipment out of the trailers, they told us that we had it not properly, inside the trailers. So that way, you want to have them prepared so that when you're pulling things out, they're in the right steps, I guess. And we didn't have that. They thought that's pretty small, but to us, that was a pretty big thing. I mean, in an event of a disaster, you want to, time is of the essence, so you want to be prepared for that. What was the day like to fit the needs of our facility? Well, we started the morning off bright and early at 0800. The instructors reviewed the course material, bringing along with them their own personal experiences. That alone is awesome. Just knowing their experiences, what they've gone through, what they've seen, what they've heard. Because like I said, us in a small little town like that, we just don't see it. The 3.5 to 4 hours of classroom work. Since the volunteers were training us, we provided lunch for them. I mean, that was the least we could have done for them. Like Dave says, it's all, they come down, volunteer. They don't expect anything. Just great group of people. Getting the decontamination equipment and setting it up, practice, practice, practice. The rest of the afternoon, staff was shown the location of the disaster trailers, how to hook them up, and where to stage them. They also were shown removing equipment from the trailers and setting it up, and then also tearing down the equipment and placing it back in the trailers in a helpful order. There's a few little pictures of us getting things out and set up. What did you say? Test? Yeah, we did have a test at the end of the day. We reviewed of what we learned and highlighted specific areas to prepare staff for the test. Afterwards, discussed recommendations from instructors on how to improve the equipment that might benefit our facility. We thought when they got there that they were just giving us guff that we were going to have to take a test, but it was actually a really good test. It really was. I hate tests, and it was good, very good information. Anyhow.
All right. So to end the presentation, we want to thank Dave Byrnes and his group and the volunteers that came down. Like I said, they do it for free, and they're doing it to educate the critical access hospitals in our region. So if you and your facility think you'd benefit from this, contact Dave Byrnes. Like you said, he left his cards up here, and they're a great group of people. I mean, it was a fun day. It was exciting, easygoing, laid back. We had a lot of fun. So.
Yeah, laid back. We all like laid back. It was a good experience. If you really, like Megan said, take the opportunity. If Dave and his group come down, they're a good group of people.
And just let you know, our core group, because we're such a small community, our nursing staff, our EMS, we're all in the same maintenance department and security. They're also EMS, they're also fire. So the group that we had to pull together are our housekeepers, our laundry people, our kitchen people. It's not medical personnel. So these people that are part of this core group that we pulled together to do set up the disaster tents, to triage patients, I mean, they're learning from scratch. So it was definitely a great day because we had to get these people trained and learn how to do this because they're going to be the ones on the front line, not the nursing staff, because we maybe have 2 nurses on site at any given time. So.
And they were actually excited when the day was over. So
it was great.
Good deal.
So thank you.
even though we are the government, we're very customer service oriented. So whatever your facility needs or wants, we can do the best we can to provide that. We've got some folks on the hook right here. The VA is looking at us. So I'm really glad that they took the time to come up here today and talk about this, because that's what it's all about. It's not just showing you stuff on a slide. It's actually letting the folks that experienced it with us talk about it. So thank you, you guys very much for coming. And thank you for letting us on.